Seven is not being a very willing participant right now, but it is time for the weekly Vol Vet Review.
Hi, I'm Dr. Klosterman from the University of Tennessee College of Veterinary Medicine. I'm at the Farm Animal Hospital here, and this will be our second video in the series following up with urinary obstruction or urolithiasis in our sheep and goats. And so in this video I want to talk about what will happen once you bring your animal into the veterinarian to get checked out for this when you suspect that they have this. And then also we'll talk about one of the more common surgical procedures that we do. So first of all, when you bring your animal in, we're going to start with a quick evaluation just to make sure that the animal isn't crashing and burning right away, and then we'll have some questions that we'll ask you, such as how long this has been going on, has the animal received any medications, what their diet is like, what the signs that you have been seeing are, and then from there we'll kind of move into our actual physical exam. We'll take their heart rate, their respiratory rate, listen to make sure that there aren't any abnormalities, and then also a temperature and things like that. And then we'll move on to kind of looking at their urinary system. And so this includes kind of palpating along their bottom of their abdomen to see if we feel any swellings or if they're painful in any area. And then we'll move on to an abdominal ultrasound. And so in that, we're looking to see if their urinary bladder is enlarged, because that is one of the major signs that there is an obstruction, at least partial but usually complete. And then if there is an obstruction and their bladder is big, we are also ruling out to make sure that we don't see free fluid in the abdomen, which could indicate that urine is starting to pool in the abdomen. And then at this point, we'll check out their urethra and make sure that everything looks okay there. There doesn't seem to be an obstruction or a rupture in their urethra, because if that's the case, then we need to have a talk about how serious this can be, because it could decrease the prognosis. And so as far as treatment options go, we do have a few different options that we can try. And once the exam is done, we will come talk with you kind of about what's happening. And then also, depending on where you're at too, sometimes we'll do abdominal x-rays, because this can help rule in or out the type of stones that we can see. Some of the stones we can see on x-rays, and if we do have those types of stones, which I have an example of, they're called calcium carbonate or golden BB, and so we'll be able to see those on the x-rays, and if we do see them, then that's an indication that we'll probably have to do further surgery and remove them wherever they are, because we won't be able to treat those medically versus the stones that we can't see on x-ray. And so we'll come have a conversation with you, see if surgery is an option, and if that's the case, we'll be moving probably towards a tube cystostomy to start with if the animal is fairly amenable to that. That's the type of surgery where if everything goes well, they can start to urinate normally again, and also if they're a breeding animal, then we can start to hopefully continue to use them as a breeding animal. We'll also do a little bit of blood work just to check their electrolytes and everything like that, their kidney values, just to make sure that we don't have any major changes. If it's been going on a while, we probably will have major changes, and so they'll need a bit more of medical management as well. And so from that, then we'll kind of make our plan, and we'll move forward with the surgery, and then we'll go on with post-operative care, and that'll be a topic that we'll talk about in our next video series. So thank you very much, and again, I'm Dr. Klosterman.
For those that don't know, after Seven had a very long stay at the University of Tennessee Veterinary Hospital, we had a really amazing relationship form with their vet team there, and because of that, we would love to continue to educate. So we have started doing a weekly episode where various vets, Dr. Ursini kind of takes care of the horses, and now Dr. Klosterman is talking a little bit more about smaller livestock, including goats. And so this is our second episode talking about urinary blockages within sheep and goats. And this time she is going to address some of the things they do to treat these urinary blockages. So I'm going to give it over to Dr. Klosterman, and I hope you'll enjoy. I hope you found that very helpful. It's super helpful to me as a goat owner. I actually had a wether that we had to do one of those operations with as a child. And so looking back now, I think, hey, we probably could have helped him even more had we had this knowledge. So this is such an amazing opportunity to be given these educational episodes from the University of Tennessee, Knoxville. So we are so grateful to them. Stay tuned for next episode. And please let us know what you would like to hear about in future series.